Far beyond witches and wizards is the root cause of health problem of many in Africa. Seek professional advice concerning that your health matter.
I see with my clear eye. The eye that I cannot be able to use 2 years ago, I use it now to see everything. And I say, may God who make this man have this mind, and all those doctors over here, God will bless them and give them more life.
Join DrSaveAlife Foundation.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Hello, nice to have you again in this edition of You and Your Health, preparing for a big and fruitful year. A year that has to be like a year of our restoration, considering what we really suffered last year. And it's affliction shall not rise the second time. We're also very hopeful that the COVID will not also undo us this particular year. So, on that very accord, we started the year with laying a very pretty foundation on how to get it right this time around. Several people have suffered a lot of health problems, and the health problem has lingered over and over again. Most regrettably, if you ask them what is the cause of your problem, it's either they do not know the right diagnosis, or they will frankly tell you it is the enemy. On that very accord, I want you, as our custom is, take this very time. Call your friend, call your neighbor, say, hey, tune into this very station right now. He comes here. At this very point in time, call the person to tune in. You have done something you will not imagine, not just money. Do that. I will be right back.
You and Your Health with Dr. Richard Okoye.
Ignorance is the mother of personal destruction, a voluntary misfortune, and it is worse when you are ignorant of your ignorance. Doing something same way, expecting a different result, is another demonstration of madness. If you have done what you think you know concerning that your health problem, why not seek for professional advice? If you lose money, you lose something. But if you lose your health, you lose everything.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. You are still on You and Your Health. I'm your friend, Dr. Richard Okoye, the president of DrSaveAlife Foundation, a non-governmental organization with a clear vision of giving total health to the people of Africa through the power of knowledge. And today we have a very disturbing, honestly disturbing, even though it's recurrent, happening in our society, where there is a particular unquote, unfounded scriptural verse that says you have to deliver like a Hebrew woman. And just last week, a woman went carrying pregnancy, 9 months, went into labor, and the labor was delayed. She was having obstructed labor. It was beckoned upon for lady house in the other section. The pastor, he said someone was calling. I don't want to know whether pastor or whoever, saying that you will deliver like a Hebrew woman. And incidentally, that woman, in effort to deliver based on what she may have believed, the baby died, and eventually she ruptured her womb. Before the battle to be able to save her because of the bleeding, she equally died. Now we have in this country the highest mortality rate in terms of the maternal mortality, neonatal and infant mortality. How do we prevent this? Let us first of all be able to analyze that. Is there anything in the Bible you call Hebrew woman delivery? Or is it just an ancestral ignorance that have been carried out over the years and being transmitted to people without anybody asking questions? Now we tell you, That particular story of Hebrew woman delivery is found in Exodus, the book of Exodus 1 verse 15 to 19. All right? I want you to go back again as a Bible scholar, read it again. I will tell you. Let me be in position to explain this to you right now. That particular story pointed out that Pharaoh ordered that the midwife should be in position to kill the male children. All right? While they spare the female babies. Okay. And that instruction was to reduce the numerical strength of the people of Israel. On that accord, the Bible recorded that these midwives feared God and did not do as the king of Egypt, Pharaoh, commanded them. And we are saving these male children alive. That is how Moses was also saved in the very process. And it happened that that very incident got to the ear of Pharaoh. That is like they are not killing the male children as commanded. By reason of that, Pharaoh summoned those midwives and asked them, why have you not done as I commanded and you spared the male children alive? I think I want us to now to get the basis of it. Let's look at where that particular scripture, the confusing one, came from, which has been shared as an ancestral ignorance and illiteracy as it were. Let's look at 18 and 19. And the king of Egypt called for the midwives and said unto them, why have ye done this thing and have saved the male children alive? Now, that is the response here. And the midwives said unto Pharaoh, because the Hebrew women are not as Egyptian women, for they are lively and are delivered and the midwives come in unto them. Perfect. So, what happened here? Let me explain it very well. When the Pharaoh called the attention of this woman, why did you do that? If the women open their mouth to say, we do not want to obey you, O king, can you guess what will happen to them? Of course, it will wipe everybody off. So, in a self-defense, even though the women saved the babies alive, in a self-defense, they say, oh king, no, we didn't. Only that the Hebrew women were smarter, that even they deliver before we come to them. That is not true. It was a defense of the people against the onslaught of Pharaoh. And that's exactly that ignorance has been shared all over. That today you will come to church, someone will be giving testimony. And what is the testimony? Praise the Lord. I was in labor, and the doctor said, after checking me, sir, we go for cesarean section. And all of a sudden, I reject it. And I say I was delivered like a dreaming one. And all of a sudden, I deliver. Praise God. Hear me. It's a distorted testimony. Why should I say so? Those that died, that are in the grave, that are silent forever. Those that lost their babies will not come to the altar to share testimony. No, they won't. They will either be blaming the doctors or maybe blaming God himself for not being able to intervene. Those that will cover it all will cover it with one devil or one demon. Of course, those that will lose their womb will have crisis in terms of fertility, and crisis may eventually come into their marriage if their husband happen to be rich. Of course, he's a ritualist. He must have used the womb of the wife to go and do money ritual. The rest of us, me and you, will be the witches and wizards that will be responsible for tying of the womb. How long can we remain in this darkness? For how long? Hey, listen to me. It is a product of ancestral ignorance. Say no more. There is nothing like Hebrew women delivery. The book of Jeremiah 16 verse 19 was very plain. He said, our fathers have inherited lies, vanity and things wherein there is no profit in them. It is time for us to begin to look at how things be. Did you know what happened in that particular event? For the Pharaoh gave an order, destroy the people, destroy their maize, let them not come up, let Moses not come up as a deliverer. But God made those women to fear him and did not kill those babies as was expected or instructed. That is in confirmation with God's word that said he frustrates the devices of the crafty, that their hands cannot perform the enterprise. That was what was demonstrated there. I'm not telling you that you should not be in position to deliver normally. Should I tell you something? There's a promise of God with respect to delivery. He declared it very plainly. He said, you shall be saved in childbearing. That is God's promise. You shall be saved in childbearing. You can deliver by vaginally. You can also by cesarean section have your baby. Both you and your baby be good and be fine. Stay tuned. I will be right back. When I come back, I will open your eyes to see why you should not support the continuous slaughter of our women in the course of going for labor, which otherwise should be a blessing and not a sorrow. Stay tuned. I will be right back.
You and Your Health with Dr. Richard Okoye.
Are you consulting for yourself? Select your main complaint. When did you first notice the fever? Do you feel cold as well? Kindly describe your appetite. Do you have headache? Please wait as we analyze your complaint and plan your treatment. Take 1 tablet immediately, then repeat after 8 hours. Thereafter take 480 mg morning and evening for 3 days.
You and Your Health with Dr. Richard Okoye.
Welcome back. You are still on You and Your Health, a program sponsored by DrSaveAlife Foundation, a non-governmental organization with a very clear vision of giving total health to the people of Africa through the power of knowledge. Very deplorable and very painful to tell that Nigerian life expectancy is seated among the world top countries like Afghanistan and the rest. 55 years. And we came up and said it's not acceptable. Such can change, but it's changing from the fact that there are certain misconceptions, misdirectional, wrong things we have been doing regarding our health, and we are coming up with professional information. If you have any question, contribution, feel free to ask. You passing through a medical condition you don't understand. Not that I've gone to roadside and I did tests and they say nothing, therefore it's a spirit. Ask that question, get a professional advice. We can't continue in this death sentence. Now let me use this opportunity to explain to you why what happened to that woman going in labor and lost her baby, herself was no more. Now the husband is a widower and somebody else that will be there saying you must deliver like a Hebrew woman. Of course, the person will be at home waiting for another victim. But we can't allow such to continue. Not in this age. I will tell you some of the things that could happen to a woman for which there may be a need for cesarean section, including what you see, in the northern part of Nigeria. You have a religion that actually promotes early marriage. It is a complex establishment that we don't have to analyze. But we have to think, what do we do? There's what is called VVF, vesicovaginal fistula. It's the big grammar, don't mind it. What it means that somebody delivered, and there happened to be a hole that created from the bladder into the vagina, and you see a young girl that just delivered. After delivery, some days after, she will start urinating through the vagina or start waiting everywhere. most time they cast these young ones out. They were sent out as if they are outcasts in the society. I will have the opportunity to tell you exactly what happened to them, and those things are not something that should keep them on the road. It's not something that we need them to be cast out as if they are not part of us. There is a solution. They are not suffering disease. It's just a defect. I will explain to you how that happened also. But now look at me. In obstetrics, that's what is called cephalopelvic disproportion. What does that mean? For a baby in the womb to come out, all right, there is what is called birth canal. Okay, that very birth canal, the baby has to go through that birth canal. But in a situation whereby this very baby, for instance, is big, and the birth canal of the mother is just that small. Just think about when you are talking about a place that is a very narrow place and a trailer is trying to pass through there. Most cases, the baby will not be able to come out. The baby will struggle to come out. The mother will push and pull. After a while, that very baby will start getting weak. That very baby may not come out, and that very baby may die. In addition to that, because the pressure is coming on, the labor pain and contraction, it may contract like football and burst inside. And when the womb tear, it will be with torrential hemorrhage, bleeding. It may not, if nothing is done as quickly as possible, that woman will die. Just like the story that just happened now. If the woman was pushing, they said, go for CS. He said, I will not go. And I will deliver like a Hebrew woman. The baby died. The woman teared the womb. And eventually, the woman died. He died because of excessive bleeding. Because most of the cases, if there's no blood sufficient to be able to help this woman in an attempt to secure the bleeding, the woman will be gone. Those that may survive it may likely lose their womb. Because on the course of struggling to make sure, because the womb may tear, at that time he may not be able to control the bleeding. The next one is to remove the entire womb. There are couples today, their marriage is in disarray, not because they don't love themselves, because of what happened in the course of delivery. Some of them don't have womb again. Some of them don't have womb because of the issue of womb tear, and the only option to save their life is to remove the womb. How long can we continue on that? How long? Now, let me tell you why it is a challenging thing that it's not every woman you see. It's after all, my mother born. You're supposed to born. No. Women womb or women pelvic bone are not same. Now, let me show you something here. If you have a look at this, these are two different hip bones, all right, pelvic bones. These are two different pelvic bones. This very one you see here, this very one you see here is what is called gynecoid pelvic. Yes, this is the normal female that has matured, not like your young girls, because the young girls may not have developed a very good pelvis. That's why most of those young people, young girls those that married early, have pregnancy, they usually have problem in delivery. Because of what they describe as contracted pelvis or smaller pelvis. But this particular one, you can see the whole shape. This is roomy. And you see the pelvic floor angle. The angle is wide to be able to deliver this very baby freely. And there's also a bone, the sacral bone, about this axis. If you watch, when I compare, you find out that this is for female. This is female and very good. This woman can perfectly deliver her baby. On other factors, being equal. Then you look at this one. This is what is called android pelvis. It's common in men. It's common in men. And if you find out now that here, this very bone shoot out a little more, and also the angle of delivery. So women have this kind of pelvic bone. As a matter of fact, up to 20% of women do have this type of pelvis. There are other types of pelvis. You have the androploid and also you have the platyploid pelvis. These are all for academic purpose. But what I'm trying to explain to you here is that a woman with this type of pelvis, she's not abnormal for Christ's sake. Only that this is how nature has made it. If this woman can't deliver her baby, you can section the baby and the baby will be out. You shall be saved in childbearing. That is God's promise. But a woman like this may have a situation, the baby is very big. And he said, deliver. You must deliver like a Hebrew woman. We are killing a lot of people by reason of ignorance. What I'm sharing here today is paravention. You have somebody trying to talk about Hebrew woman delivery. Can't you be in position to help out? Even a pastor trying to use it to pray, call the attention and say, can we read this Bible portion again? Our women have to be saved. We cannot be increasing the mortality rate, maternal mortality, neonatal mortality in this side of the world. It's not acceptable in any way.
You and Your Health with Dr. Richard Okoye.
I cannot believe it that this is the same me that came here with not having the hope of being on my feet again, that I can walk again like a normal human being. I want to thank DrSaveAlife Foundation for this wonderful work. To God and to God only be the glory.
You and Your Health with Dr. Richard Okoye. Now on AIT every Monday by 9:30 a.m.
Welcome back. Let's finally look at the subject of VVF. VVF is vesicovaginal fistula. And this usually happens if a young girl still growing but incidentally get pregnant. And as she gets pregnant and you put that girl that is having a contracted pelvic of this very nature, she will not be able to deliver the baby. So what will happen is that on the course of delivery, have a look at this. Because the baby is big, as he's pressing on the bladder, because the bladder is in front, as the head of this baby is hitting on the pelvic bone, all right? As he's hitting on the pelvic bone against the flesh between the vagina and the bladder, after pressing it for a while of that prolonged labor, all right, when it is pushed on it over the time, eventually they may force the baby come out. That's fine. She will deliver and go. But up to 2 weeks after, that very portion that was pressed over the time may begin to decay, what is called necrosis. And once it decay, it will form a hole. When that hole is created, you know what will happen? As soon as the urine gets into the bladder, instead of following the normal urethral route, it will enter the vagina. And that is what most of these very young people see in the north, most commonly suffering. And these things are not disease. They are not outcasts. They've committed nothing only because of that defect which can be closed. I want to beckon on women organizations. We can partner together to do a lot of things for our young ones. We can partner. You can call on DrSaveAlife Foundation. We can partner to save these women, even in the issue of educating them and also intervention where necessary. Let me use this opportunity to beckon on anyone that believe in this. Believe in this cause. We can't remain in this kind of darkness. How could we be? We are spiritualizing every health problem. Somebody will have prostate cancer, it's an attack. Stroke is an attack. This is an attack. Heart attack, heart failure, cardiac arrest, all happening, and we will say it is one demon, it's one this. You can partner to save the life of our people. Prostate cancer is a slow growing tumor. It doesn't just come and all of a sudden it spread everywhere. It grows slowly before it goes out. If it is picked early, the person can be cured 100%. A lot of intestinal cancers and all that, even most of the heart attack and all that, with ECG, we can trace a number of things that is about to keep many people become widows, widowers, and all that. We can partner with DrSaveAlife Foundation to run a program for your community. As say, being in position to prevent preventable death. We can partner together. You can call any of this number on the screen to reach to us. You could also be in position to support financially wherever we can partner with you to ensure we do that. God bless you. This is the much we'll be able to take today. I will come your way again. We continue to bombard thee until it become a testimony in the land of the living that Nigeria is a better place to be when it has to do with healthcare delivery. God bless you as I see you again.